And good afternoon, and welcome to the 6th Annual Pathways to Hope Conference. My name is Tanya Ryder, and I am the Director of Justice, Equity, Diversity, and Inclusion for NAMI National, and I will be your workshop session moderator. Please share your first name and zip code and any speaker-specific questions and comments in the Q&A box on the lower section of your screen. Again, welcome to everyone, and let's get started with a few housekeeping items. If you are attending the conference to receive continued education units or CEUs, please listen carefully. All registered attendees seeking CEUs must remain in the session for the entire duration. These sessions are approximately 75 minutes long, so 1.25 CEUs will be issued upon approval and in the areas of LPC, LMFT, social workers, and psychologists. Each attendee can qualify for a total of 4 CEU eligible workshops Friday through Saturday. A post-session survey is required, as well as a daily conference evaluation. For those joining us out of state, please follow our CEU instructions, but it will be your responsibility to seek final approval from your state's credentialing board. We are grateful to have the support of NAMI Texas and the Behar County Recast Project for making these CEUs available. Again, all registered attendees seeking CEUs must remain in the session for the entire duration. So now it is my pleasure to introduce the speaker panel. Jasmine Quinones has been with the Kiva Centers for 5 years, building solid working relationships through Massachusetts and serving as the consummate goodwill ambassador for the Kiva Centers. Jasmine is a Massachusetts certified peer specialist, certified RAP wellness recovery action plan, and TIPS trauma-informed peer support instructor, and has completed IPS, Hearing Voices Network, Alternatives to Suicide, and Children and Family Advocacy training. Jasmine received the Angel Award in the South County CHNA area for 2 years in a row for excellence in community collaboration. She has been recognized by the Salvation Army for her collaborative community work in South County, as well as being awarded as an unsung hero of the Salvation Army's disaster relief team. One of Jasmine's greatest professional achievements was the honor to work alongside AMSCA, Puerto Rico's Department of Mental Health on the island, bringing the Kiva Center's model of trauma-informed peer support to their population in need. Because of Jasmine's coaching and dedication to the cause, Puerto Rico will soon be opening peer-run centers inspired by the Kiva Center's model throughout many areas of Puerto Rico. Outside of work, Jasmine is a mother of 2 wonderful children who she loves to dote on. The beach is her happy place, and that's where she goes to recharge her soul. Vesper is a community activist, survivor, trainer, and writer. They have been a part of the Kiva Centers for several years and have been instrumental in the Kiva Centers' growth as an organization. They have brought the perspectives of survivors to national and international spaces. They have experience working as a consultant for both the United States government and the United Nations in shaping strategies around trauma, intersectionality, and disability rights. They gave an address on intersectionality as a human rights issue for the UN Convention on the Rights of Persons with Disabilities. They have been at the forefront of legislative reform to shift the societal paradigm around mental health. Vesper concentrates on building social movements and public knowledge to facilitate and sustain systems change. They are a skilled certified trainer of intentional peer support and the Massachusetts Certified Peer Specialist training. They have supported the development of peer-run organizations in different parts of the world. They have been a lecturer for many universities and institutions across the United States. They are a very well-known leader in peer support and are known as a powerful advocate. Thank you so much, Jasmine and Vesper, for being here, and I turn it over to you.
Thank you for having us. And I think one of the most important things to always start off with is to honor the land upon which we gather. Again, my name is Vesper Moore. I use they and a pronouns. I'm with the Kiva Centers. I'm Kiva Centers Chief Operating Officer. I'm going to pass it over to Jasmine for an introduction, and then I'm going to do a land acknowledgement for us before we delve into managing our mental health in COVID times.
Hi, good afternoon, everybody. My name is Jasmine Quinones. I am the Director of South County and Multicultural Services for the Kiva Center. My pronouns are she, hers, ella, and ellas. I'm so excited and happy to be here and participating with y'all in this discussion. It's very important to us, and yeah, can't wait to dive in. Thanks, Bess.
Fantastic. So I just want to take a moment to honor that the land upon which we gather is the seized and occupied territory. For us in Massachusetts, we're on Nipmuc land, but for folks in San Antonio or joining us from wherever, you can actually find out what land you are on through the Native Land Act. But I want to say that the land upon which we are gathering, we are honoring the Nipmuc people. We want to recognize the tribes that have federally been recognized and have not been federally recognized, because there are many, and their ancestral ties to these grounds. With that being said, I think COVID has been a difficult impact for all of us. And one important place that we want to start is that when we're talking about the conversation of mental health and we're talking about the impact of COVID, that we're starting from a place of thinking of COVID as a collective trauma. Now, thinking about something in the SAMHSA, SAMHSA really ties upon this in trauma when they speak to trauma is widespread, and it can be directly and indirectly felt. As you join us here, I want you to think a lot about how COVID may have directly or indirectly impacted you, your families, or your communities. And what does that really mean in regard of mental health, community mental health, the impact of mental health, and where you are coming from? Something that we've noted is that a lot of BIPOC communities have been, impacted disproportionately throughout COVID. A lot of Black, Indigenous people of color. We've seen a lot of violence. We've seen a lot of murder of Black people, particularly from police brutality. But we have also seen the impact on communities feeling less and less comfortable stepping outside, building connections, because they are at risk of being either exposed to something or having something happen. Along with this, we see a larger shift in the conversation around vaccines, right? And that disproportionate impact on BIPOC communities too. There's not a lot of the consideration of the impact of trauma on BIPOC communities, especially after we've seen, trauma, particularly around how science and, or more specifically, pseudoscience has harmed BIPOC people in the past. And even if vaccinations are helpful, how do we participate in engaging in meaningful conversations that are intersectional around the vaccines, Pfizer, Moderna, and otherwise. And what are some of the struggles, right now with autonomy of body, with both being exposed to COVID, but also, having this vaccine. So I want us to think about that a lot too during these conversations. Something that's been very important in managing my own mental health during this time of COVID has been taking the intentional time of thinking about some of that trauma impact, but understanding how I value myself independently from what I'm doing in my work or in my personal life. Because I feel like we are stuck in this haze of, almost like productivity over really considering ourselves in a lot of respects. I think when we talk more about conversations around COVID too, we think about trans folks who are living with their family or roommates that might not know that they're trans or interested in transitioning, right? And the impact of COVID and having an intentional community space to talk about that. Talking about how mental health in this regard, we're really focusing on the environmental impact. The fact that trans people can't have conversations via Zoom, just like this, with their supportive community without the possibility of someone hearing them if they live with someone, because they do not have the ability to maybe live on their own or for whatever reason, or maybe a lot of their procedures are on halt because they can't see their doctor right now. They can't connect in those ways. I'm going to take a moment to pass it over to Jasmine to speak about the impact of COVID and the vaccine conversation, particularly in the Spanish-speaking Hispanic community.
So some of the impacts when it comes to COVID, and especially when we're talking about communities, have been the loss of income. So so a lot of population that we wouldn't have seen that was a need prior to this now, is reaching out saying that, they need, that they need help, whether it's small businesses, whether it's self-managed businesses, self-employment. I mean, so many people have been affected by COVID-19. Coming from the Latino population, especially, it has been very difficult because they feel like they've been, almost like in second place. A lot of the information that is getting to them is not translated. A lot of the information that is accessible, that is available, is not accessible to them. So we've really not given access, to everybody, not just in the Latino culture, but just in many cultures in general, and really take into an understanding of cultural appropriation when it comes to, COVID-19 and when it comes to vaccinations and the information that we're providing and how we're providing it and the trauma behind a lot of, Latinos and other generations and other cultures and how they're going to perceive the COVID vaccine and, information that, they can read, that they can understand, that they can log on easily. So there's definitely been a lot of challenges with that. So just, taking the time to just be, respectful and mindful that not everybody takes in the same information appropriately, that they don't understand the information, that they don't really understand really what's going on in their environment, is definitely something that, us, especially at the Kiva centers, has been striving for, is to be able to help people just say, let's take a step back and understand you and your needs as to why, you're not understanding or why the information is not being provided, and advocate and help our communities at large receive all of the support and all the supports that they need.
Yeah. I think it's, I want to get to one of the questions in our chat, but I wanted to start with the fact that there's been, on one hand, accessibility opportunities that have been offered to disabled folks. What Jasmine's really speaking to is the cultural humility and cultural responsiveness approach that is also needed in the context of culture. How do we engage in these conversations intentionally, connect with someone's upbringing and background, right, in that culture, and be like, although I don't understand and I'm not the expert in some of your experiences, can we, share and connect around those experiences? I do want to say, in terms of like disability justice and access, there have been considerations of accessibility in some regards. I saw in the chat someone really appreciating the closed captioning. I have the closed captioning on. I'm actually glancing down and reading the closed captioning as I'm speaking. I just find it as a good way to stay organized, really support me. I'm someone who grew up with a stutter, so I actually find it helpful in that regard. And sometimes with my own mental health, sometimes I may hear things that, may cancel out what other people are saying. So having closed captioning is very helpful in that regard. And I think for a lot of people, the ability to either work from home, if they have a job that is flexible in the ways in which they can work at home, having these virtual platforms have been important. But I can say also in the regard, we should strive to continue to be accessible, right? And even though we're accessible in some regards, we may not be accessible in all of those regards, right? So in terms of coming into physical spaces and how they can be accessible in those ways, but also accessible to how people interpret information, understand information, receive information, share information with each other, right? All of those things are really important. And when we talk about specifically the ways in which I see the peer support movement growing, per Julie's question in her chat, I really think more about one, that the peer support movement taking a more intersectional approach in understanding the overlap, right, of oppression, the overlap of identity, and why those are important in all of these conversations. I actually think COVID's making us think about it more. I think we think more in a space of trauma, and again, this being a collective trauma, and thinking about how we're managing our mental health at these times. It's very important to consider, like, how are other communities impacted? Why am I impacted in the ways that I'm impacted pertaining to my identity, my upbringing, where I come from, my culture, my gender, my sexuality, otherwise? Like, how is there an impact there? When I think a lot about, Julie brings up the point, like, I am deaf and verbal, and that Julie is hoping in the future to be bringing peer support to deaf and hard of hearing communities. Do you feel this may be an option for others as well as in this area that is left out? Thank you. What I think a lot about with deaf and hard of hearing peer support, because we at the Kiva centers have established deaf and hard of hearing peer support in certain spaces, and have made sure that it is very much deaf to deaf, right? Because there's a cultural element. I think that there's always kind of a mistranslated element amongst the hearing people, people who are not deaf, that there isn't a culture to deafness. So I can see peer support growing in the way of understanding that culture more, and then as a whole, understanding intersectionality. I think we're seeing more with peer support right now an approach to disability justice that is intersectional, intentional, and is trying to consider all identities. Some people identify more so with their mental health diagnosis and may identify with a mental illness. Some people might identify with their experiences as hearing voices or emotional distress. Some people might identify as disabled in their experience. And it's important to make sure that we hold space for all of those experiences. I think peer support, we've very intentionally tried to re-explore ourselves independent of diagnosis, because we're talking a lot about the conversations of oppression around diagnosis in our mental health. And we've done so much that we've actually excluded a lot of the conversation around disability too. And we need to include that more. We need to talk about how systems in society can be more accessible to our diagnosis and we as we are, to our minds and our bodies. And I would say, again, we strike that right back to the cultural responsiveness, cultural humility conversation, because cultural humility is access for culture, just the customs, the arts, the shared knowledge of people, of a group of people, right? So when Jasmine's talking about how, we as Hispanic people, for example, we're having a lot of, struggles with one, information around COVID, and two, information around the vaccine, and that there's an inherent, there can be an inherent distrust or a challenge sometimes with that vaccination, or the fear around COVID. That's because often in the United States, even though the United States is the second largest Spanish-speaking country in the world, we approach things from very much the standpoint of okay, we've translated the materials in Spanish, but we don't need to translate the new ones, right? We don't need to interpret. We don't need to interpret what this may mean, and we do. If we don't do that, communities are missing out. So when I think about the peer support movement growing, I think about one of the principles of disability justice, which is leadership of those most impacted. I think about us as communities who are most impacted in one way or another, taking the leadership to speak to a lot of these issues. And when we're talking about the impact of COVID right now, I think that is very, very important. So we have another question. What are your top 3 tips for helping people to manage their mental health during the COVID-19 pandemic? You have any tips that first come to mind, Jazz?
Oh, I'm sorry. What was the question? I'm sorry, Bess. I was reading the other question that just popped up.
Oh no, that's okay. It says, what are your top 3 tips for helping people to manage their mental health during the COVID-19 pandemic?
That's a very, very good question. And us as an organization, that's one of the things that we, when the pandemic first hit, we just kind of like collectively said, okay, how are we going to do this? And I have to say that one of the things that specifically for me, as I run my own Kiva Center, is providing safe spaces for people to have really genuine connections and conversations, safe spaces where you can say whatever it is, however it is that you feel. There's going to be no right or wrong answer. There's not going to be any judgment. There's not going to be any opportunity to to have people look down on you. It's one of those spaces where it's genuinely about you, about connecting with others that are also feeling the fear. It's also reaching out, and allowing people to know that you're there, and connecting with people, like there may be some people that I haven't talked to in a while, just sending them a quick text, like saying, hey, I'm here, and allowing, that space for, human connection to happen, because, isolation does happen. And as a parent that's working full time, actually, we're working a little bit more now because we're in the mental health sector, but also have, a teenager at home, and a spouse that also works outside of the home. There's been a lot of challenges, and you got 3 people working under the same roof. There needs to be a space to be able to disconnect, and then just giving people that genuine opportunity to say, hey, all bets are off the table. What is it that we truly need to address? And people have really appreciated that transparency and that way of connection. Another is, just really taking the time to understand people, to just be a little bit more lenient, a little bit more, a little softer, and, just allowing people to, to let them be angry if that's what they need to be, not taking anything personally, understanding that we're in a really difficult time, and every single person in the world in one way or another has been impacted by COVID-19 and continues to be affected by COVID-19, so just my stance on, just everyday interactions with people. Self-care for sure. Understand. I know we always preach self-care, but really more than ever now, making a schedule, taking 10 minutes for yourself, taking a minute, whatever it is that you need to do for you. So then that can make you, a little bit more flexible and aware of, your surroundings, a little bit calmer. So those are some of the things that come to mind to me, during this time.
I think I want to add to that just by saying, when Jasmine was talking about fostering safe spaces earlier, it's very important that, in this time of racial justice and what happens, like I, as a brown Hispanic person, may not feel safe in a lot of places. I may not feel safe even in my own home, because a police officer might burst down that door and something might happen to me. Right. But I think when we talk about safe spaces, we also refer to them as brave spaces too. We're talking about intending, safety as much as possible, because you can have conversations about how unsafe you feel and what that relates to you culturally, individually, and otherwise. I'm actually going to share something from our Kiva Centers. It's a tool. It's through our certified peer specialist training. We teach this tool. It's called, it's from cross-cultural partnering. And it's about, first you must learn about yourself, right? To gain a lens into yourself, really, really gain that insight before you gain insight into others. Like, I think that's very important. From the role of a peer supporter, really thinking about like, oh, what is the impact COVID has had on me? Why, and again, what is that related to culturally, ability wise, and otherwise? And then secondly, learning about the individual person. They start to share their experiences, really learning about that. And then overall learning about the culture. The culture is more about the nuance and what is needed in those moments. I think some tips to help people in managing their mental health at this time is Jasmine was talking about self-care earlier, and I think it's important to also like differentiate self-care and self-soothing. So like I watch Netflix, for example, and that's self-soothing because I'm not thinking about, maybe I'm watching like a reality TV show, maybe I'm watching a cooking show or something, and it's not immediately pertaining to some of the distress that I might be experiencing in my life. So it's soothing in that way. But I also think when we talk about self-care can be setting things up structurally in a way that can, help you moving forward or support you moving forward, right? So like, for example, self-care could look like, budgeting your finances and trying to save more. Self-care can look like actually just like taking a shower and taking a moment to, to take care of yourself physically in a way that's going to benefit you moving forward. I think in the context of mental health, having spaces where we have those honest conversations about the impact of COVID is fine. And I think tying it back to the peer support movement again and back over to mental health, now is a great time to talk about mental health. I think we now more than ever need to, because I think everyone is realizing the impact of it, whether or not if they've been someone who's considered with a mental health diagnosis that could be categorized as a serious mental health, diagnosis or otherwise. It doesn't matter. Right now, everyone is experiencing some type of emotional distress. And I think transparency and reciprocity is crucial throughout that.
I also agree. Julie, I saw your chat and I also have to agree with you. Definitely advocating for folks who necessarily don't have a voice. And, I really, that's also helped me as well, being able to translate materials for my community, being able to bring, community members and seniors to vaccination clinics if they need it, being able to deliver food. I mean, the Kiva centers, we've delivered, during the pandemic, over 2,000 boxes of food, being able to at least be able to help my neighbor and be able to, advocate and be able to say, yeah, this is exactly what's going on. And I see you, I see you, I hear you, and allowing for that advocacy to be present and to happen has also helped me. So I definitely am with you on that, Julie. And it's very important. And like Vesper was saying, taking this opportunity during the pandemic to really show what the importance of mental health is, and the different categories that it comes in, that there's so many feelings right now, and that all of them, every single one of them is valid, and that we really need each other's support in order to be able to make, of this new world that now we're all living in. And how are we going to connect with one another, and moving forward, what does that look like for us? And yeah, it's very important. And I'm with you, Julie, on that. I just wanted you to know that I saw your comment and I'm right there with you.
Yeah, I also want to highlight a few other comments. There was someone who said that we should be allowed the flexibility as essential workers to have the option to work at home, right? And I think, a lot of organizations and communities are trying to adapt to that. And I think that yes, our physical well-being is important right now. I think simultaneously there's like this need of like, oh my goodness, like as people who are in these essential working roles, that it is important to sometimes be physically present with someone. People feeling like they need that physical form of like connection by being in the same space with someone. And although that is very important, I think that it needs to come in waves. That really what we've been seeing in a lot of states is what a lot of people have been referring to as a hybrid model, where they've been doing a lot of online with some in person, trying to do outdoor gatherings, small group gatherings, people maintaining being masked, and then also meeting virtually and having just as much of a thriving community virtually as you would in person, right? I think immediate resources have also been important throughout COVID. We have delivered thousands of meals. Jasmine, could you talk about the thousands of meals and the community fridges?
I'm sorry, what, Bess?
Could you speak to the community meals we've been delivering and
Sure.
the community fridges?
Yeah. So I live in an area that I have a Kiva center in an area where unfortunately there's not a lot of services. And one of the things that during the pandemic came out was food insecurity. You know, we don't have a lot of pantries. We don't have, you know, a lot of food resources. There's a lot of seniors in our area, and how were they going to be able to access, you know, food safely and, you know, still, you know, be able to take care of themselves, et cetera. So I partnered up. I already have a collaboration project that I do with the Salvation Army in South County at my office, and we were given the opportunity to be able to distribute meals, food boxes, personal hygiene products, and pretty much anything that someone needs to be able to take care of themselves safely, take care of themselves, have a good diet, hygiene, like with masks and other PPE materials and equipment. And so we, you know, we just started reaching out, and we delivered during the pandemic. We delivered well over 2,000 boxes of food within central, you know, throughout our catchment areas and beyond. And then we partnered up with a local organization that opens up community refrigerators, which is a refrigerator that provides 24/7 access to foods, healthy foods, primarily fruits and vegetables, dairy products, etc. No raw meats. There's certain things that can't go into the refrigerators, but it's allowed us to be able to open up multiple refrigerators throughout our catchment areas. And it's something that we're going to keep going, because there's a lot of things that we don't think about during the pandemic. And, you know, for those communities that are already struggling, you know, when somebody says, oh, prepare for a pandemic, some people can go out and buy all the toilet paper out, right? Or they can afford to buy all the paper towels out. But there's a lot of communities that can't do that because they're living within a certain economical guidelines that don't allow them to do that. And so to be able to partner up with different organizations and to be able to provide the security for people that they need during this time has been really, really important to us as a community, and being on the front lines. So, and it's not work that's going to go away anytime soon. We're going to continue to do it as long as the need is there. Yeah, it's been really, really, really important work and really good work at the same time. But we've been able to utilize our advocacy, you know, to be able to advocate for the needs of our community, and been able to get a great response, you know, from everybody around us, and trying to help and making sure that the community gets served. So.
It's great work. Seriously, food justice is mental health care when we think about it. Immediate resources are mental health care. And I think that is often missed. They're like, oh, if it's not, you know, this particular dialogue or engaging in these ways. No, sometimes we need to address the systemic and social issues that lead to the traumas that people experience, that can lead to the diagnoses and the other impacts throughout their lifespan. That is a public health approach. And, you know, I wanted to acknowledge, you know, we often understand this in the peer support movement because we have lived experience with these forms of oppression. So when we think about intentional approaches to COVID-19 and managing our mental health and doing a lot of this work, we think of it through an experience of our own lived experience, because our lived experience is our expertise. That is what we offer. We use that as a way of then creating a lens or an approach, if you will, that is inherently more mutual and more connected. I do want to highlight something Stephanie said in the chat from Catholic Charities, how I find resiliency through this pandemic is attending peer-to-peer classes and Texas Empowerment Initiative classes on mental health peer specialists. I would love to help this career field with a decent pay. This field greatly needs help in the field, and I would like to be a part of it. And then just really talking about self-care, walking, going fishing, doing Bible study online as some of the options of things that, you know, Stephanie and our other people may use to stay well with their mental health. And I want to highlight here, you know, that often peer support workers aren't paid a higher wage. At the Kiva centers, we try to pay people, you know, at least $18 an hour if we can. Sometimes contracts can be a little bit less than that, but at least that is our like goal, right? We try to make it higher than the minimum wage in the state. I think that the trouble is that that's not always sustainable because our lived experience, you know, isn't always viewed as that expertise that we can offer. And I think that that's when we get into the issue of larger oppressed communities being impacted. You know, when you think about someone with a mental health diagnosis, or our society, right, thinks about someone with a mental health diagnosis, there is this inherent idea that they are incapable or unable to do the job or to do it the right way. And then there's inherently a behavior, often from supervisors and organizations, that are like, I can't be accessible to this person. I can't work with this person. It's taking too long. They can't do this. They can't do that. Instead of really, you know, engaging and trying to understand their experience and where that comes from. And how that parallels with COVID is that right now, when you're talking about approaches to mental health and COVID, it is crucial to understand that person's experience, their community's experience, and their background related to their body, their minds, and diseases and viruses, and how those things are interpreted, and how fear can be ingrained in certain communities, right? One thing that I think is super important is in group living environments, often referred to as group homes or other environments. There are a lot of people who live with mental health workers, and they're being told, you have to keep your mask on, you have to do this, but there's no explanation as to why. Why do I need to have my mask on? Why could this be important? And are they being given enough information about the vaccine? Are they being given enough information about what they can do to keep their physical body safe from COVID, right? A lot of people in group living environments share cigarettes, and they don't often think about that, right? That's like why is that exposing? Why could that be dangerous? And what does that do to others, you know? And engaging in intentional conversations in that way, not from a place of diagnosis once again, but more of a place of behavior and experience, because that's what's going to lead to the mental health piece. I think that that's why, you know, when we get going back to Samson's definition of trauma, where we talk about trauma being widespread and it being both directly and indirectly felt, that is the more indirect piece. You know, we're not having enough of those intentional conversations with our community. Yeah. Jasmine, do you have anything to add to that around intentional conversations that maybe you've had with your community?
Yeah, I think that there's a lot of spaces and, you know, categories and all kinds of things that we don't take into consideration when it comes to, you know, masking and, you know, the trauma, you know, behind it and what it means to some people, and culturally, you know, what covering your face, you know, does, and, you know, and so there's a lot of room for education during this time, you know, for us to be able to learn amongst the people who we're living with in our communities and our society, you know, so we can have a better and a broader understanding as to, you know, the reason why choices are being made. You know, for some person, it may be like, oh, well, they don't want to, you know, abide by the CDC guidelines or, you know, or what have you. But, you know, to them, it's that, you know, they've been in a situation where, you know, they forcefully have had somebody covering their face or choking them or something, and, you know, putting something in front of their face for that a certain amount of time, you know, brings back all kinds of traumas, you know, it brings back all kinds of memories, you know, so understanding people, you know, where they're at and where they're coming from, and allowing them to have those types of spaces to say, okay, even though a mask has to be worn here, but you can take a mask break in the bathroom, or, you know, outside, or, you know, giving people the opportunity to be heard and understood and not made feel less than because, you know, they can't abide by rules that have been given to us, you know. So I think it's just been an opportunity for a lot of good conversation pieces and a level of understanding that's going to take us way further than, you know, just the pandemic.
I really appreciate you bringing up the point on the mask covering. You know, there's so many Sikh and Hasidic communities, Hasidic Jewish communities and Sikh communities that actually view like having their beard present as like that is a part of their spiritual expression. And like when I've been supporting folks from these communities, they're like, I don't want to wear this mask because before the eyes of my God, like I won't be able to show, you know, this part of my natural body and what I have committed to my God. Like, and that's a very important thing. Or when we think about deaf and hard of hearing communities, like our question earlier, you know, having a clear face mask can be important so people can read lips. Like a lot of that nuance too is very important to access. And a lot of these intentional conversations culturally in communities are very important. Just going to check and see if there are any other questions. Okay. Any other points in the chat? Someone brought up living wage. We were talking about peer support. Yes. I think, you know, some of the most important pieces during COVID and maintaining our health as well is definitely taking the time to. We've talked a lot about considering the impact of COVID, but it's you also have a right to just step away from it and not think about it for a while. I think that, you know, we can often think as well, you know, in people who either work in mental health or otherwise will often focus on the impacts that this community or this is having on different communities. And I think that this is, you know, a very important piece that we often end up stuck in this lens of like productivity and what we can do for other people. And there's so much that needs to be done all the time. How can we help people? How can we continue to do this? That we don't actually have, you know, the same type of consideration for ourselves, you know. And then when we don't have that consideration for ourselves, we truly can't support the people that we work with, you know. And I think for the people that we work with, if they don't have resources, and let's say that they're not working, and let's say that they're not housed, and that they're struggling, they're facing the very real reality of being exposed to both the elements, and to this virus, and not having a lot of that information available. So again, you know, I think immediate resources, intentional community conversations, continuing follow-up on what those communities believe they can do for themselves and each other, and fostering that, right, is really important to managing your mental health at this time. I want to highlight a few things in the chat. Julie would love to connect on Facebook. Great. You can follow us at Kiva Center on Facebook. We also have an Instagram, Kiva Center as well on Instagram. Kiva Centers on Instagram. So, and then Stephanie said, Vesper and Jazz, I also attended a case study group for community health workers about COVID-19 cases to help advocate and recommendations of resources, anyone suffering with mental and physical health. And that's so important. You know, community health workers often concentrate on those environmental factors that can impact someone's health. peer support workers, we're often concentrating on the life factors that can impact someone's health as a whole. So I think it's so important that, for example, when it comes to a community health worker, that they might be working with someone who has asthma, right? And that person with asthma might have trouble breathing. And that might exacerbate a lot of their struggles around their mental health diagnosis. And that breathing might be environmental because they have mold in the ceiling. But their primary care never thought to ask them if they had mold in their ceiling or to check their ceiling or to look around, right? But the community health worker, as someone who has lived in this community and may have lived in those housing projects, may understand that from their experience. And then the peer support worker that might be working with that person may understand what it's like to have your mental health exacerbated by something physically happening to you and can have intentional conversations around that. So I think that really highlights the value of lived experience as well. Leadership from those most impacted, I think, again, that disability justice principle is really crucial right now at this time when we're supporting communities. Thank you. And we have another piece here. I participate in the community conversation seminars to stay abreast of current peer information. I also make sure I am getting CEUs when I can. So I will be able to keep the certificate and continue when the time comes. I participate on community panels when asked on any subject. Thank you, Cynthia. That's also an important point. You're always working to get that information out there, to connect with people, make sure that they're aware of what's happening right now and staying current. And not only that, for yourself, you just mentioned something that could be more self-care. You apply for CEUs. So that way you don't have to stress about having those education units needed for recertification or relicensure, right? And I think that's such an important point too when we are working in social services and mental health largely. So we've talked a lot about supporting communities. We've talked a little bit more about peer support. And we've talked about some of the experiences of wearing a mask. I think Jasmine also mentioned earlier, particularly for trauma survivors, that wearing a mask can feel smothering, and if you've had the trauma of something happening to you, to your face, it can be difficult, wearing a mask can feel uncomfortable that way. I've also heard about masks hurting the back of people's ears. I think it's always important to have other options available. There are masks with strings that go behind your head on either side of your neck. Masks that have that option. There are, if you look for the KN45s, I say the KN45s, even though normally it's the N45s, but online, if you find the KN45s, they're kind of more of a cone shape that comes out. It folds in half, gives you more spatial breathing if you wear that mask. But then the N45s structurally and medically do protect you more from exposure to COVID. So I recommend those masks if you're ever working with someone or if you yourself feel like a mask is smothering. If they're available, sometimes they're not available and they're hard to find.
I'll take this one. So the question was, what's a little bit, it's a statement more or less, that they feel like, Mary, I feel like a lot of people may be struggling with their mental health, but may not necessarily be that. COVID has been around for a while now, and I think that people are exhausted and it has affected their mental health, but forget the gravity of being in the middle of a global pandemic and don't know if that makes sense. It totally makes sense, Mary. We're all so tired. We're really, really, really tired, and it's so hard to keep concentrating on something when we're this tired, when there's so much information being thrown at us every single day that is interchanging, or it's important for us for our own health, to keep ourselves safe, to keep our family safe. The kiddos going back to school, Now what do we do as parents? Are we making the right choices, by sending our kids to school? Have we been, nobody's even talked about the kids' mental health, and how much they're suffering as well, not being with their peers, especially if they're, the only children in the home. Like I have an only child at home right now. So, there's a lot of different factors and layers that are just completely exhausting. And yeah, it is terrifying, and it's really tiring to every single day have multiple layers of information being given to you. When you thought you were doing the right thing, you got to scratch that, right? And then you got to do something else because a new CDC study or the FDA or whoever, came up with a new study. And it's just really hard to follow. It's really hard. And so that's why allowing each other to have those safe spaces to have conversations and to say, yeah, we're really, really exhausted, and, the exhaustion is getting in the way of me being able to make the best decisions that I can for myself, or can somebody help me, just read this out loud, let me know how this sounds to you. But yeah, no, I'm with you, Mary, in total agreement. It is very, very exhausting. And just to know that, there's no end in sight can also be very exhausting. So we're right there with you, Mary.
Yeah, and I want to say, it's okay to be honest and have those genuine human relationships, right? In those conversations and be like, hey, I am exhausted, or hey, I'm not feeling 100%. As I'm coming to this group, or I'm going to this meeting, or as I'm talking about what's going on. There have been so many young adult peer support groups and adult peer support groups that I've been facilitating, and everyone is just like, it is just awful. I just want this to end. I just want this to be over. My grandmother died and I wasn't able to see her. I lost my housing opportunity because of this. I've lost access to these things because of this. And honestly, that is just very real. I don't think that there's like an immediate solution to that. That is just like, that is valid of a conversation, right? That is valid of talking more. And then as organizations, as supporters, as people in communities, wherever you are, connecting to those resources or having resources immediately available to support people is so important, right? Having all of the information on hand, but also, food, also technology for virtual supports, also connecting people to housing opportunities that are available. I know Massachusetts just launched a very large housing connector website that actually connects to affordable housing options around the state. Building more resources like that online, coming to platforms that are more accessible to young adults is important, right? Having information that's available on platforms such as TikTok, Facebook, Instagram, Snapchat, otherwise can be important as well. And having information in smaller text blocks. There is something to be said about how information is disseminated and shared, and the fact that and then often people tie this to ADHD, right? That the fact that information is being shared at such a quick pace and is being taken in at such a quick pace that people's attention isn't really there in the same ways. I like to think about it too with young adults and a particular generation of how that information is disseminated and shared, that it's so important to have information that's accessible to young adults and not having too much text, not having multiple pages, but really getting to some of those points, right? I think when it comes to resources, it's good for organizations to join together to create statewide resources and statewide events. I found that a lot of that's been important throughout COVID. And we've been talking a lot about overdose awareness this year. Our Kiva Center's community has lost a lot of people to overdose. Next month is Recovery Month, and we're thinking about celebrating recovery and what that means to people and the reclamation of recovery around substance and or mental health experience, however people are identifying with recovery. But really, what does recovery mean? More specifically, what does resiliency mean when you're coming back from over a year and a half, going on 2 years of fearing of what's happening to you and your loved ones? What does that mean to us? And I think we should have more conversations around it. We should be talking more about voluntary, community resources around mental health and making it more accessible. We should be talking more about funding resources that could be free to the broader community, such as peer support and other initiatives like that.
Yeah, I agree as well. I think that this time really allows for some really good conversation pieces, to bring on a governmental level even. I know somebody, I forget the name, I apologize, had talked about income control or something around that nature, and I think that this gives the opportunity to really say, yeah, and raise those voices like, hey, rent control is so necessary, making sure that groceries don't go up and just essentials, everyday essentials for people to live in. Because, most of us are living paycheck to paycheck and we don't have, any room or leniency to be able to stock up in masses like other people do. So, so that's why having certain systems in place that allow people to live a dignifying life, so when pandemics happen or things, out of our control happen, just even in everyday life, that we can have the opportunity to say, well, you know what, I do have that extra $20, to go out and buy a box of masks. I don't have to depend on anybody to, bring me some for free, or, I have that extra couple dollars to stack up on snacks and, be able to get myself where I need to. The cost of living in the United States has gone up significantly. And it's so sad, that when things do happen, unfortunately, we don't have the opportunity to be able to say, okay, we can take this on, and have a plan B, because even our plan A is not, allowing us to live the type of lives that we deserve to live. So the pandemic has definitely brought on, a lot of challenges, has brought a lot of things to light, and I'm hoping that, by bringing all these things to the front end, that, we're able to keep on, on a governmental level, keep these conversations up so we can bring, a little bit more stability, to the working class, to all of us, to all classes, in respects to, living and especially those who are already living with fixed incomes, I'm hoping that we can, use this platform and utilize this time to really keep the advocacy going and hopefully make some changes.
Agreed. I think that that's something that's very important, and that advocacy. It's important to have advocacy for what is needed for I think more systemic and social change, but it's also really important to have sustainable grassroots community-led approaches that we are building while we are advocating. We should support our own, we should support each other, while also building approaches that work in the communities, which is why earlier when you were talking about the community fridges, Jasmine, the great thing about the community fridges is that communities take care of those fridges. Some organizations, stock the fridges as well, right? Normally nonprofits or otherwise. No, people don't necessarily police the fridges, right? People come to the fridges, they can take food at whatever hour. It's not restricted in that way. There's a pantry attached, right? And a lot of people are like, what if you steal the food? Well, the thing is that the food isn't stolen because it's just there to be taken, right? And it will be restocked regardless. So even if someone's taking food and selling it, right, that's not really a worry. It's more about just making sure that it is continuously stocked to support the community. And I know that we faced that too. Like we've had that happen with the community fridges where someone's taken the food and went, and we've had those intentional conversations of, hey, that doesn't mean that we should shut down this community-led approach. right?
Exactly. It's an honor system.
Yeah,
It's an honor
exactly.
system. Yeah.
That's been so important.
Yeah, and it's been a really important aspect of being able to bring communities together, to say, hey, I have a little bit more, that I can share, seeing communities come together when it comes to these fridges, schools and boys and girls clubs and, just so many different organizations and churches and just community, come together and, pay, respects to the refrigerator and stock it, and everybody giving what they can to make sure that it's full, and farmers markets and everything has been really extraordinary to be able to help it at that capacity. And we're hoping to be able to keep this going for sure.
Another point brought up, we need an accessible hotline or fast track to all of these resources and have the manpower to help people in this crisis and have a turnaround time. And I very much agree. There needs to be a way in which someone can contact a number, and those resources are all available in some type of redirectory. And we've been doing that, a lot of that work here in Massachusetts. We've been trying to consolidate a lot of that information, and we've been encouraging other communities that we support around the country and around the world to do similar things. And I think that that's very important, having immediate resources that are available, and that even if someone didn't have a cell phone, right, or a form of technology, they can find a way to access those resources. Like whether if that is just having the printed information constantly available in churches and barber shops, in community spaces, right, laminating it and having it on the walls, but then simultaneously also having it digitally and cellularly available.
Yeah, agreed, Stephanie. One of the things that is always that I talk about all the time is that you never know how many resources there really are, even like in your own backyard, because it's not advertised, or they're nonprofits, so they don't have maybe this much money for a big marketing department, etc. And so when communities come together and they're sharing resources, and you're like, oh my God, I didn't even realize that existed, or I didn't know that you've been working in my, in my backyard for 20, 30 years. I wish I would have known. I would have been able to support you. And so I think that, yeah, that's so important, and especially with the work that we do. And I know, and I'm not for certain, I can only speak to Massachusetts, but I know that 211 in Massachusetts was actually trying to start an emergency resource guide, and and so you were able to call there and pretty much say what area you're from, and then they would send you something either to your email or to your physical address, with different resources in the area. The only thing is that unfortunately, some of these are volunteer based, I found out. And so the information hasn't always been updated. But yeah, definitely because there are a lot of services out there, unfortunately, we just don't know about one another. So sometimes we're recreating things that don't need to be recreated. So yeah, definitely, that definitely should be a plan, and there should be a way for us to be able to get our hands on that type of information and or materials for sure. I know for us, I mean, during this pandemic, if you want to touch a little bit, Vess, before, we run out of time in regards to the peer respite and, some of the work behind that and the reasons why we wanted to open up, a peer-led respite in the middle of a pandemic.
Yeah, absolutely. So we opened up Peer Run Respite on January 4th. It is the 30th in the country. It is the 2nd in Massachusetts. If you're not familiar with the Peer Run Respite, it is a crisis alternative that is run by peer support workers, people with lived experience, with either, with psychiatry, mental health, trauma, some type of lived experience, supporting others with those experiences. In order to qualify as a peer-run organization, your organization needs to be run by 51% people with lived experience. And by that means if you're a peer-run organization and you open a peer-run respite, it would qualify as a peer-run respite. So we opened a 6-room peer-run respite in a hotel, which is very interesting. As an immediate response to COVID, we didn't know if we were going to have it in the long term. We didn't know that if it was going to continue to exist. It is going to exist. It's funded for 7 years now, and we're moving into a house. So exciting, awesome stuff. And we've supported over 200 people. We've also offered mobile care respite. We go to people's homes or wherever they are at a social distance, and we have a conversation about their comfortability, right, during that support. And we support them for up to 4 hours at a time, multiple days out of the week or more. And that has been really great for, the overflow that's been happening in emergency rooms, the overflow in psychiatric mental health acute units, the overflow in state hospitals, and people coming out and needing that immediate support. I do want to say, peer support and other resources like this isn't something that we can just standardize. It's always so personal, but we always try our best to understand it as much as possible to make sure that we are offering the best peer support we can. Our peer run respite is called Karaya Peer Respite. We don't have too much information available about it on our website. You can look at peerrespite.com if you want to learn information about the respite. You could also reach out to us at either the emails I left in the chat or on our website if you want to learn more about peer respites too. I think it's been so important having these conversations around COVID, and when we talk about communities and intentional communities, I do briefly want to mention something that might be important right now, especially as we're talking about the variant with COVID and spaces, is that if you operate like a mental health space of some type for support, or a physical space, maybe a community space, a social service space, however you may define it, that right now could be an important time that even if your team is working remotely, to take some time and to work on that center and equip it to be a space that minimizes the exposure of COVID as much as possible. I'm talking about like devices that you can put on the wall that can dispense hand sanitizer and sense your hand. I'm talking about latches on doors so you can open them with your foot. They're called foot latches. I'm talking about couch covers. If you want to use couch covers, you can also use Lysol spray every time, buying up on Lysol spray. Having disposable masks available, having laminated resources, once again, like I was talking about earlier, but getting into the flow of wiping them down once a day, right? Having charging stations available for people living without a home or unhoused people, and maybe having one staff person on site so they can come in and not letting in more than 5, right? Or if they need a glass of water, or if they're picking up a food delivery, right? Something like that. So those are all some additional things that we've been doing that I'd like to offer. I'm sure many of you have been doing something similar, but sometimes we don't always think about these things because we've never been in a pandemic of this magnitude before, and we can be gentle with ourselves. We don't have to be prepared in this way. We're still figuring it out, right? So I just wanted to offer some of those solutions as well. All right, just seeing if we have any more questions. That's a fantastic, seeking a short-term way to help during the pandemic and now having a sustainable solution. Congrats, thank you. We applied for it. It wasn't initially a peer respite model in the funding. It was actually funded as a clinical respite that was available. We're a peer-run organization. And then in our master service agreement, we wrote in the contract a peer respite-like approach. So we were able to reconfigure a clinical respite into a peer respite, which is pretty cool. People self-manage their medications. We have conversations about accessibility and cultural responsiveness in our interview process beforehand, and we found that very important. So if you're interested in opening up here on respite, again, feel free to reach out to us. All right, with that being said, we have about, I think, 6 minutes left.
Hi, Vesper and Jasmine. I just wanted to kind of jump in and just say thank you so much for sharing your wisdom and your experience and doing the work that you do. And I just wanted to share that myself as a person with lived experience. I love how you both spoke about our lived experience being our expertise and the importance of having these community conversations. What came to mind was, how do you heal individually, but how can we heal together as a community? And I just love the idea of just saying we need to come together as a community so we can convene, so we can collaborate, and so we can co-create what that healing looks like for our community. So thank you so much for just all your insights and for this reminder that, something small that we can do is, and I'll just share this is something that my team and I, or any folks that I'm on a call with, we ask, how are you doing? No, how are you really doing? And it's okay, and just because healing happens in community, not in isolation. And many times we feel like we have to have this mask and everything has to be so perfect and all the time. That's exhausting. And we need to find those times where we can recharge our batteries. And I'll say personally, this type of conversation recharges my batteries for sure. And I just, again, wanted to thank you both for all that you're doing. And I just wanted to jump in. And what came to mind? I wanted to share that quote from Audre Lorde about self-care, which is so important. And she was a writer and civil rights activist. And she said, caring for myself is not self-indulgence. It is self-preservation. And that is an act of political warfare. It is very important that we take care of ourselves. And I'm a big proponent of radical self-care. What does that look like for you to honor yourself? Because if you don't take care of yourself, you can't do the things that you need to do and the things that you love to do. And so I do want to remind all of us, we are passionate about the work that we do. It's something that's a part of us, but we do need to take those breaks, and it's important to do so. So anyway, thank you again, Jasmine and Vesper. And I think unless there's anything else, any other questions, I just wanted to make sure I got some time in before the session ended. Okay, so just a reminder that the recording of this workshop will be on the NAMI San Antonio YouTube channel. When you close out the session, you will see a survey pop up. And your feedback is really important because it helps us for future conferences and what content you want to know about. And also, if you are going to be seeking CEUs, you do have to complete that survey. So thank you again, everyone. And we wish you a wonderful rest of the conference. Thank you.
Thank you.